celebration. Remember, they canceled it in August. It's moved now to this Saturday. Folks, as promised, we have Batson and Associates, Jason Batson and his guests. We're on.
Good afternoon. Good afternoon. So, how are you doing?
I'm okay, man. Yeah, man. Nice to have you. Sorry for the little mix up there, but we're on. Better late than ever.
Yep, exactly. So, let me say a pleasant good afternoon to the listeners of Freedom 106.5 FM. Always a pleasure to be discussing health from a natural and integrated perspective. You have yours truly, Dr. Jason Batson, the Senior Medical Director at Batson and Associates. I'm joined, of course, this afternoon with Mr. Stefan Villalva, who is our Senior Consultant and Blood Microscopist. Mr. Villalva, how are you doing?
I'm fine, thank you.
Good. So, of course, the topic we're discussing today, keep in mind, we would be touching a bit on hormonal imbalance. We'll be speaking about the endocrine system. We'll also be discussing what we at Batson and Associates do to really help individuals to really overcome, to really get improvement where, disease is concerned, whether you're dealing with diabetes, hypertension, cardiovascular disease, hormonal imbalance, and the list goes on. Keep in mind that we are live on our social media platforms. We are Batson and Associates Limited on Facebook. On Instagram, we are Batson and Associates TT. And on YouTube, we are Batson and Associates Trinidad. Keep in mind as well those telephone numbers and location. Head office is Shogunas. Shogunas is the first floor of Money Talks building in Montrose, Shogunas. And that number, of course, is 222. That's 222-8261. Again, 222-8261. And of course, the program is interactive, so we will appreciate your comments, any questions you may have regarding any products, services, any health question or issue that you may be having. Third base, of course, you remind them of the telephone numbers for that, and we'll start the ball rolling.
Of course, our numbers are 627-3223-625-2257, and our WhatsApp messages 306-1065.
Good. So we're discussing hormonal imbalance. We're talking about the endocrine system. So just before we started the program, I was having a discussion with Mr. Villalva. And we were just wrapping as regards to how things went for the week in the offices of Batson and Associates. And we were actually speaking about the importance of hormones being balanced, especially as we tend to get older, especially women. Now, hormonal imbalance is a challenge that men have as well. It is not really something that is spoken about a lot, simply because, a lot of people don't really recognize that men could have an issue with that. And of course, women is what we tend to focus on. Women who may have problems with things like polycystic ovarian syndrome, endometriosis, which is thickening of the uterine lining, women who may have problem with extremely painful menstrual cycle, or even irregularity. Right, Stefan, and at Batson and Associates, and interacting with so many patients on a daily basis. In your opinion, especially as it relates to the blood analysis, how do you use that tool to really guide or identify problems with persons who have hormonal imbalance, and what do you really introduce them to as regards to that?
Okay, so as it relates to the live blood analysis, one of the things that we see as it relates to the live blood analysis is oval shaped cells. And oval shaped cells in high quantities will indicate hormonal issues. So what we do going forward is we would send persons to do laboratory testing for further diagnostics like FSH and LH and so forth, or estradiol for persons who may have fibroids in terms of that development there.
Right.
And of course, recommend proper diet for them to regulate their estrogen levels as well going forward.
Okay, so but is that something that you see quite common at the clinic?
As it relates to of recent, yes.
Okay. So, you know, and with when we speak about oval shaped cells, I know oval shaped cells, and I, you know, myself as a blood microscopist, I mean, I haven't been under looking at under a microscope for maybe some months. I try to keep myself, you know, as up to date as possible.
Yes.
You know, when you see those oval shaped cells, is a clear indicator of a number of things: problems with metabolism, problems with digestion.
That's right.
Right. And, you know, as a practitioner, one of the things we recognize, especially with women who have hormonal imbalance challenges, is that you always see some sort of gastrointestinal imbalance.
Yes, that's
You
right.
agree with that?
Yes, I agree.
Okay. And from that particular perspective, you know, I tell persons they are neighbors. Your colon is right there, and then the uterus is basically to the front of the colon.
Yes.
So females who may have problems with excess gas, a lot of bloating, constipation problems, the likelihood of them developing issues with uterine health is significantly increased.
Yes.
In addition to that, let me say, of course, a pleasant good afternoon to Ms. March Hills, Ms. Elizabeth Mary. These are individuals on our live stream. Keep in mind, as I said, we are live on Facebook. So if you're not following us on Facebook, you can do that. We are Batson and Associates Limited on Facebook. On Instagram, we are Batson and Associates TT. And on YouTube, of course, Batson and Associates Trinidad. Keep in mind, again, those telephone numbers for our locations. We are located on the first floor of Money Talks building. That is Money Talks building in Montrose, Shogunas. And of course, you can call that telephone number to get all the numbers for the other offices: Davie, St. James, Tobago. That number again, 222-8261. Again, 222-8261. To this, you'll just let me know when you have questions, right, sir?
Of course, yeah.
Yes, definitely. Good. So, from the perspective now, as it relates to hormonal imbalance, I know at Batson and Associates, there's a product that we carry called Women's Formula. And what Women's Formula actually does is really help or assist in regulating the endocrine system.
Correct.
Now, in regulating the endocrine system, just based on your experience, you know, how would you explain to the listening audience, you know, the importance of the endocrine system as it relates to hormonal imbalance, both men and women?
Okay. So the endocrine system is one of the main and one of the most important, I should say, systems in the body, because it helps with developmental aspect of a human being. In terms of from a child, you will then become a full-grown woman or a full-grown man and so forth. It also increases your testosterone. It increases your libido, your sex drive. It also helps with your moods as well.
Correct.
On a day-to-day basis. So it is very imperative as it relates to the human body. And one of the things I've seen as time progresses, as going forward, persons with high levels of stress, it affects their hormones as well. You know, sometimes you may eat healthy, you may exercise regularly, but stress is a factor that depletes the body as it relates to the endocrine system as well.
Okay. And, you know, just to reiterate or add to that, you know, one of the things that you find is that with stress, the stress hormone being cortisol, once that stress hormone is very high in the body, it now makes it easier. Like women, for example, who may have problems, because we do have a weight loss program that we offer at Batson and Associates. Different types of weight loss programs, of course, for different needs, the type of individual we're dealing with. What you always find is that women who have hormonal imbalance challenges, they may be trying to lose weight for a number of years, months, years, and it's not successful. And the reason for that primarily is because of those imbalance in the hormone, that stress hormone being very high. Once cortisol is very high in the body, it creates an environment that is perfect for inflammation or inflammatory response. And with inflammatory response, we know any disease could now take place in the body. So that's to help a lot of individuals to understand. And a lot of persons don't really get that. You know, you might be going to the gynecologist and you know, you may have a hormonal imbalance challenge. What is normally recommended is birth control. Now, you know, from the perspective of integrative medicine, I personally have an issue with that, in the sense that what that really is trying to do is actually beat your ovaries into submission. And that, of course, is not going to work, because you're going to end up in a situation now where you have not, one, identified the root cause of the problem. So whether it's gastrointestinal along with inflammatory, excessive levels of cortisol, as you mentioned, high stress, that has now resulted in this particular situation, whether it's fibroids, polycystic ovaries, irregular menstrual cycle, painful menstrual cycle. So to correct that situation, you really need to again deal with the root cause of the problem, gastrointestinal endocrine system. At Batson and Associates, there's also a product we carry. So we have women's formula, which is basically a capsule. One of the things that really does, as I said, is to really balance the endocrine system, and an imbalance in that system, because the endocrine system, for those of you listening who may not be aware, is primarily a gland. So your thyroid, parathyroid, pituitary, adrenal, and so on.
Yeah.
Those glands are responsible now for the production of hormones, as Mr. Vialva said a while ago. So, you're looking at things in the case of a male and even female, because women have testosterone in much lower levels than men, of course.
That's right.
And men as well even has estrogen, very, very minor. But the problem is you could reach in a situation where those hormones are now out of balance.
Yes.
And in a situation like that now, it sends the whole body in a tailspin. Yeah.
And also, as it relates to the, as you mentioned, that men have very little percentage of estrogen. Based on the foods that men are consuming today, as well as plasticware, you're reheating in microwaves and so forth.
In plastics.
In plastics.
Right.
It elevates the estrogen in a male, and he starts developing like man boobs.
Right. Gynecomastia.
Yeah. You
Right.
can also get like a bloated gut or a protrusion of the gut there as well.
Right.
Which is like female characteristics there. And well, women, they will then start getting issues like excessive hair growth.
Hair growth, right. Facial hair.
Yes, hair, facial hair, and so forth. And as it relates to the medication that you would have mentioned, which is the birth control, they also will recommend metformin sometimes.
Right.
Because when a female estrogen starts to increase, it also, the body starts to secrete insulin, which
right.
is a storage hormone. So, and they will give you metformin to regulate that insulin there, because it's also for diabetes. It's a diabetic medication.
Good.
And it is not kidney friendly.
Very good. Well said. Yeah, so you see, so the objective, as I always tell persons, when you're looking at health, you want to be in a situation where you're actually addressing the root aspect of the problem, because you don't want to be suffering from this for years. One of the observations I've made over the years in practice, I always tell persons that ovarian cancer doesn't start off as ovarian cancer.
Yes.
Uterine cancer doesn't start off as uterine cancer. Prostate cancer doesn't start off as prostate cancer. There's always some level of imbalance taking place in the body.
Right.
The question is, most of the time, is our body speaks to us, but we do not listen. Where you see those slight so ladies listening, women, even parents of these very young women, and I know Stefan, that's something that you would have observed too as well. At Batson and Associates, we have more and more young females, adolescents, 13, 14, 15, 16 years coming to us with issues with hormonal imbalance.
Yeah, that's right.
I know for a fact there's a client, we got a testimony from that client. Her daughter was 13 years, or is 13 years, and it was actually recommended for her to use birth control. Yeah. Of course, her mother, being in the medical fraternity, had some challenges and issues with that, being a nurse. And, she came to us, and we were actually able to regulate the menstrual cycle, because what this child was experiencing is where you would have a month or 2 months where they don't get the period. And when the period actually comes, it is very, very painful and very heavy. That's so right. She actually had to be missing school and whatnot. So, those of you parents out there, even fathers who may be single parent, you have your daughters, you must have some female family member, whether it's your sister, their aunts, whatever the case may be. So do some investigation, ask questions, because, they mightn't be comfortable coming to you. Because there's a situation I know with this young lady who had serious issues with her menstrual cycle. Single parent, so father and other siblings. And, she was a bit, timid to go and talk to the father about it. And he only realized that she had a problem when she couldn't go to school that day. And, the menstrual cycle actually came, and it came so heavy that she actually had a blackout. Yeah. So it's only after that, in questioning her, he realized that she really had a challenge for some months, but wasn't reporting it. So parents, that's for you out there, you have your school age, your teenage girls, pay very close attention to them, ask the necessary questions, because, it's something that people tend to be very, a little timid and closed up about. But, at the end of the day, the objective is always to get to the root cause of the problem, because you don't want your daughter, you know, when they're getting into adulthood now, they reach a stage where they're hearing that they have some sort of ovarian cancer, they have a very large cyst. That 13-year-old that I'm referring to, they actually had a cyst that was like about 8 centimeters on the right ovary. So imagine the type of pain that they were getting, because you know, she reached a point that every time she would be expecting the period, she would take painkillers like about 5 days in advance. So imagine a 13-year-old taking this kind of medication. You know, they could actually end up in serious problems associated with their kidneys, and of course, that's not something that you want to experience.
And also, because of the size of the cyst, it could press on the connective tissues.
Correct.
And the nose will be compressed. So you get radiating pains, not only in the abdominal area, but also to the back.
To the back as well.
Yeah.
Excellent, excellent. So again, those telephone numbers and locations. So you can come have a consultation if it is you are doing the blood analysis, the magnetic resonance analysis, which we'll explain a little bit. As Mr. Villalba so rightfully said, you know, there are additional tests that we would require. You know, if we need to see the FSH, if we may need an abdominal pelvic ultrasound to give us an idea, because that's very important, because that actually gives physicality as regards to, you know, the size of the uterus, size of the ovaries, that type of thing. So those telephone numbers and locations, quickly, you can call the Shoguna's office, which is 222-8261. That's 222-8261. Debe is the corner of Ramsonwood Trace and the SS Erin Main Road in Debe. That telephone number for Debe is 223-7515. 223-7515. St. James.
St. James is located at the Red Edge Mall in St. James, and the contact is 220-8113. That's 220-8113. Our Tobago location is at this Triangle Building in Scarborough, and the contact number is 226-4553, and that's 226-4553.
Excellent. Third base, any questions?
Questions?
Yes, sir.
We have a question here about problems with endometriosis and polycystic ovaries.
Yes. Okay. Yeah. So, yes, we do deal with that. And endometriosis and polycystic ovaries are, again, two signs of hormonal imbalance. Endometriosis primarily is thickening of the lining. Yeah. And of course, polycystic ovarian syndrome is just that, polycystic ovaries, because you can have ovarian cysts, which is different to polycystic ovaries. But of course, both are indicators of some level of hormonal imbalance, some level of an endocrine system that is not functioning. It also gives some indication of, again, gastrointestinal situations there. I don't know if you want to add anything else.
So as it relates to polycystic ovaries, now 90% of the times, females, they will miss their menstrual cycle. Okay, because the egg will not be mature enough to be released on the line of the uterus, which is what the menstrual cycle, that's the purpose.
Exactly. All right.
Now, some females may get their menstrual cycle, but the problem there is they will miss ovulation.
Right.
And that's where the cyst develops on the ovaries there.
Good.
So going forward, if that patient, they want to visit us at our clinic, if they have any medical reports, I will advise that you bring them in so we can have some external diagnostics and we can see the size or the severity of the issue. So we're going to recommend accordingly.
Good.
Or else we will give you a referral to get those tests done so we can see what's taking place here as well.
Excellent. Next question, sir.
All right. Good day, doctor. My daughter, like you were talking before, my daughter has been experiencing lots of pains during her period. She is 15 years old. Any help for that?
Yeah, definitely. We always in those instances would at least require a consultation. And the reason we want the consultation, obviously, is to know exactly, to ensure that we dot our I's and cross our T's if you have any allergies, whatever the case may be. But that's a problem that definitely we can address. Quite successfully. We have done it on numerous occasions, but it's a matter of coming in and have the consultation, because a painful menstrual cycle is always an indication that something is not just wrong, but something is seriously wrong. As I said before, ovarian cancer doesn't start off as ovarian cancer. Uterine cancer doesn't start off as uterine cancer. Even cancer of the cervix doesn't start off as cancer of the cervix. These are all, cancer is always cumulative and progressive. But cancer could only manifest itself in the body where inflammation is very, very high.
Yeah.
Because Mr. Vialva, you would agree with me here, when we do erythrocyte sedimentation ratio,
Yeah.
as well as the
C-reactive protein.
C-reactive protein, those are both indicators of high levels of inflammation in the body.
Yeah.
What I also know for a fact is that once your ESR crosses 100, you are almost a perfect candidate for cancer. That's because right. of how high the level of inflammatory response is in the body.
Yes.
So, you know, parents, it is a warning sign that you should pay heed to, and, you know, try and address the situation as quickly as possible. What we need to come out from is the mentality that children are too young to be sick now, because we have children 13 and 10 and 8 and 6 years with cancer, and that is cancer. It wasn't something that they were born with, obviously, but it's something that happened progressively or cumulatively over a period of time. So, you know, again, you know, feel free to give us a call or visit again that telephone number for the head office, which could direct you to any of the other offices. Would of course be 222-8261. That's 222-8261. All of those offices usually has a senior consultant like Mr. Vialva present. And then, of course, the clinics that I would do would be specific clinics that would be advertised accordingly. I'm always in Shogunas most Wednesdays. For example, Friday, Saturday, I'll be doing St. James. Mr. Vialva, which office will you be in on Saturday, please, God?
On Saturday, I'm actually off on Saturday.
Oh, okay, right. Tomorrow
I'll be in
Shoguna's office, right? So the thing is, you have access to good information, you have access to proper service. Most importantly, you know, you're going to have access to understanding what is going on with you, because diet always plays a fundamental role. Diet is a word a lot of people don't like to hear, Mr. Vialva, you know that.
Yes.
But in order for you to get the results that you want, you cannot be adding inflammation to the body, because a lot of foods are inflammatory. And if you already have excessive inflammation in the body, and then you're using foods that inflammatory, you're just, you know, as the old people say, you're spinning top in mud.
That's right.
So that's something that you need to pay very, very close attention to. Keep in mind, again, our social media platforms. We are Batson and Associates Limited on Facebook. On Instagram, we are Batson and Associates TT. And on YouTube, we are Batson and Associates Trinidad. So this.
Yeah. What about bad acne? But he says that they have very bad acne.
Bad acne.
You have bad acne?
All right. Now, acne can happen from different aspects. For example, if a person's blood is dirty, as we say, if they have a lot of toxicity in the bloodstream, the body, because the skin is the largest organ, the integumentary system, and the body will then use the pores of the skin to excrete. If that person probably have like constipation and so forth,
liver problems,
liver issues as well. So that could cause acne on the surface of the skin. However, polycystic ovaries could also cause acne because of elevated androgen, which comes after the process of elevation of the estrogen levels there.
Exactly.
Yeah.
So, exactly.
So again, I will highly recommend for that person to come and visit us at the clinic so we can be more in depth and see what's really taking place there.
Excellent. Next question, sir.
We go there first. Your reversing of the diabetes. Always the reversing of the diabetes. Exactly what do you mean by it being reversed?
Okay, good. I'll take this and then Stefan, you could take over. The thing is, when you're looking at diabetes fundamentally, in layman terms, is an excess level of glucose in the bloodstream. The thing is, glucose in itself is not supposed to be stored or left in your bloodstream for extended period of time. Glucose is actually supposed to be stored in cells, and when your body require for energy, those cells would release the glucose accordingly. Diabetes itself is an issue where you have type 1 diabetes, first of all, which is insulin-dependent diabetes. Now, I have found in my experience over the years with insulin-dependent diabetics that we were actually able to help a lot of people actually come off of insulin or significantly reduce the amount of insulin that they take, which is always going to be positive for a diabetic. Apart from that, you have type 2 diabetes, which is basically diabetes mellitus. So the body is producing insulin. However, the receptor cells are not working properly to really store the glucose. So what you find is, again, you have high levels of glucose in the bloodstream. Then you have type 3, which is gestational diabetes, which women get as a result of pregnancy because of the different changes in hormones in the body. Type 4 and 5 are pretty easy to deal with because those are really glucose intolerance, that type of thing. when you talk about reversing diabetes, what a lot of people have to understand, that will always be a critical factor with anyone who is developing or poses some sort of diabetic issue, is you have to take into consideration your diet. That is fundamental, because a lot of the food that we have now is processed food. What does that mean? It means the food fundamentally lacks fiber. It lacks two types of fiber, which is soluble fiber and insoluble fiber. So in reversing diabetes, one of the things that we have to look at, of course, is the endocrine system. We're going to have to do some work on the liver. Anyone who has diabetes, in my experience, they have a lethargic liver. Your liver does not function the way that it's supposed to. Yeah. So, in saying that you could reversing diabetes, which is possible, it depends on the type of diabetes that we're dealing with, and it also depends on the individual as it relates to their adherence to the protocol. Yeah. And once it is they do what is required, they don't have a problem. Stefan, I don't know if you want to elaborate.
Yes, definitely. All right. So before a person become diabetic, they will have challenges with insulin resistance.
Correct.
Which is where the body become resistant because you keep doing the same thing repetitively all the time.
Mm-hmm.
So you consume a lot of sugars. Now, some of the foods you may not see sugars, as we may know, but they have artificial sugars, like sucralose and all of those things.
Aspartame.
That's right.
Mm-hmm.
So you may not be aware because you probably just purchased the product. You didn't read your labels, right, and you consume those things repetitively. Your body becomes insulin resistant, and eventually the pancreas starts to give up.
Correct.
So the pancreas does not secrete enough insulin, which is type 2 diabetes. They give you metformin and other forms of medication there to regulate. However, as Dr. Batson mentioned before, you have to increase your fiber, because the more fiber you have in your diet, it will regulate your glucose naturally. Things like sweet potatoes, your complex carbohydrates.
Good.
Sweet potatoes are sweet, but it has a low glycemic index.
Exactly.
All right. Well, unless it's like white potatoes, you really want to stay away because of the starch content.
Mm-hmm.
But other forms of provisions you can consume, a lot of green vegetables, juicing on mornings, your kale, your celery, ginger, and all of these things. Turmeric as well is a good aspect because diabetes naturally creates poor circulation in the human body.
True.
So turmeric will increase some circulation there for you as well, and also exercise and physical activities.
Good. In addition to that, let me just quickly add to as well. When you're talking about cleansing and detoxifying the body, there's a product we have at Batson and Associates called Santulan, which actually means balance or equilibrium in Hindi. And what that product really does is clean the 7 channels of elimination: kidney, colon, bloodstream, liver, lymphatic system, skin, and your lungs. As you mentioned, your skin is the largest organ in your body, the integumentary system. But what you find now with a lot of persons who are diabetic, sometimes they end up with something known as metabolic syndrome as well, which is an indication. So you have wasting away of muscles. I always tell people diabetes, when you have diabetes, you're like a block of ice in the very hot sun. You all see how hot the days are these days. So, it's not as if you cannot be helped, The problem with a lot of individuals is, one, they may not have the correct information, and two, some people you're frustrated because every time you test your blood sugar, the sugar high, and even mentally, because of stressing out yourself and testing. No, I'm not saying that you're not supposed to test your sugar on a regular basis if you are diabetic, but the circulation T. We have a product called balanced circulation, which works really well for high blood pressure and that type of thing. We also, as I was mentioning, the inflammation formula, which actually naturally reduces inflammatory response. So of course, again, you can feel free to give us a visit, get those appointments, of course, to have your consultation and or your blood analysis, magnetic resonance analysis. There's an entire package that we have with that. And of course, any supplementary reports that you would have. For example, if you're dealing with polycystic ovaries, fibroids, ovarian cysts, every ultrasound that you would have ever done, once you have it, regardless of the age of the ultrasound, bring it. Bring it for us, because that is going to give us an indication, because your history is very important, and that's something that a lot of people don't take into consideration. Your history before, especially surgeries. I'll give you a quick example. I remember having this client who came to us who had serious problems with insomnia, serious problems with depression, serious problems with anxiety. And, she had gone to a number of doctors, and they would, digging all about the place, determined, trying to find out what happened to her. And then the thing is, in the form that we have, the intake form, one of the things we ask there is if you have had any surgeries. And of course, we ask you to say what the surgery was, the year of the surgery, if you could remember. But the thing is, she had a hysterectomy. And what she had was a total hysterectomy. It was even partial. Total hysterectomies are the surgical removal of the uterus and the ovaries, whereas partial hysterectomies are just the surgical removal of the uterus, and usually your ovaries are kept. You find women who do partial hysterectomies tend to be better off, where they do not really end up with emotional upheaval, so they would not necessarily have really bad problems with insomnia, depression, anxiety. But most of the time, when you do total hysterectomies, later on you have problems with high blood pressure, insomnia issues, serious problems with mood swings and that type of thing. And that, of course, all those things we deal with at Batson and Associates. But again, the information is valuable. And it's only when we realized that she had the total hysterectomy, then I was actually able to make the link. And then what we had to do was do an integrative hormone therapy treatment. And then once we did that, the problems subsided. So, that's something that you need to pay, of course, very, very close attention to as well.
And another thing, Dr. Batson, that I've realized of recent is that a lot of people, they start suffering with their thyroid. All right. Now, the thyroid is responsible for your weight and metabolism, well, growth in this case as well. So in terms of hair growth and your weight fluctuations, the thyroid will control. And because a lot of people have issues with their hormones today, the thyroid becomes involved eventually.
Correct.
So it's either hyperactive or hypoactive, which is high or low. In the high case, the body tends to increase or rev. So the heart rate will increase, your metabolic rate will increase, you start losing mass, you start get dropping of the hair, and all of these things. All right.
And problems with sleep too. In some cases with hypo.
The low case, the hypo will increase more like insomnia, constipation, weight gain, and all of these things as well. So it's very imperative to do your live blood analysis, to check your body. Sometimes you may look healthy externally, but just to check and see what is taking place there from a microscopic and nutritional aspect, so we can then recommend and break down things and elaborate on stuff for you, so you can then make those necessary changes before something becomes bad, something happens worse going forward.
Definitely. And in addition to that too as well, when you're looking at the aspect of blood, I tell people healthy blood, your blood could either be a river of life, or a river of death, in the sense that, remember how the body operates. The body always deals with anything from a cellular level. Healing could only take place from a cellular level. Healing would never take place from an organ level. So, those of you who are diabetic, what we would normally recommend is that you walk with at least 2 or 3 of your A1Cs, which is, of course, going to give you a reading of the blood sugar over a 3-month period, average.
Yeah, that's right.
Right? That, of course, is a key indicator to a number of things as regards to us being able to go forward from there. Okay, we actually have a question on our social media, Facebook. Keep in mind, we are Batson and Associates Limited on Facebook. On Instagram, we are Batson and Associates TT. And on YouTube, we are Batson and Associates Trinidad. Ms. Elizabeth Mary said that the blood analysis and the metabolic report also checks the A1C. What you want to take?
Yeah. All right. So to Ms. Mary's question, the blood analysis will not give you a quantitative report of the glucose. you definitely have to do a A1C test from the lab, so we can see, because it ranges in terms of percentages. So we will see that from that aspect. But based on your diet from the evaluation form and what we see in the live blood analysis, we will be able to differentiate certain things to prevent you from having an elevated glucose levels there.
Yes, good. And in addition to that too, when you do the blood analysis, especially when you look at the dry blood, and this is one part of the blood analysis I like, you're actually able to see what is known as oxidative stress.
Yes.
Now, I remember that was one of the first things I learned when I started doing blood analysis. But what oxidative stress tells us and what it actually shows us, because you physically see it in the blood, it gives you an indication of the amount of inflammatory response in the body. And inflammation is something that a lot of people do not know about. A lot of people now, inflammation is being tossed up in the medical community a lot now, because a lot of people now know. But a lot of people still don't understand that inflammation and inflammatory response. Inflammation is a normal function of the human body. That is actually part of the immune response. What happens to the individual is when your inflammatory response exceeds its normal limits, and then you actually have high levels of inflammatory response. So, for example, if you have blocked arteries, if you get in pain on your left side, pain in your chest, if it is you climb stairs, you get in pain, and you may go to the doctor, they might do an echocardiogram, eventually they might recommend angiogram. And then the doctor tell you, okay, you have some blocked arteries, 90%, 100%, 70%, whatever the case may be. All the doctor is really telling you is that you have inflammation in your arteries. If it is you have problems with arthritis, whether it's rheumatoid arthritis, psoriatic arthritis, or any of the other forms of arthritis, you have inflammation in the musculoskeletal system. If you have problems with Crohn's disease, irritable bowel syndrome, diverticulitis, inflammatory bowel conditions, you have inflammation in the bowels. And the thing is,
a call coming in there.
Okay, sir, go ahead.
Yeah. Hello, good afternoon.
Good afternoon, Dr. Batson and Mala.
Yeah.
I want to know, is there any cure for neuropathic disease from diabetes?
Okay, good question. So here how I answered these questions. I tell them, cure is a word that you just don't use, because cure is a word that will have you having to check some attorneys, right? So we don't use the word cure. Let's use reverse. So when you're looking at diabetic neuropathy, neuropathy in itself is actually damage to the nerves. Now you have diabetic neuropathy because you could also have neuropathy and not have diabetes. But when you're dealing with diabetic neuropathy, it means because of the poor circulation in the body, the nerves themselves have been damaged. Now, note the word, damaged and not dead. So because it has been damaged, nerves could actually be repaired, and we have seen this. The only time you get problems with nerves is when cutting has taken place, so surgical procedures and that type of thing. In that case, nerves tend to be, that's it. But in that particular case, yes, you can overcome neuropathy, diabetic neuropathy, once you have the necessary, we do the necessary tests, and then of course we make the necessary recommendations, and then you follow through, and then we do your retest, that type of thing. So those of you who may be listening, if you have problems with pins and needles, cramping in your calves, burning under your feet, you feel like these things walking on you or crawling on you, all of those are early indications of neuropathy. Now you want to deal with that as quick as possible, because you don't want to reach a stage, like Sunday I was saying when I was doing our program, you could reach a stage where yes? You were saying something to it, sir?
Sir.
Okay, right, yeah. Yeah, so you could reach a stage where a 4-inch nail, imagine a 4-inch nail go up in your feet and you don't know. That's to tell you the degree of neuropathy that that person has. And there are a lot of people who are diabetic. That's how we end up with so many amputees. Because if you have diabetic neuropathy, you could pass, you might be in the garden, you might put on a boots, you might cut your foot on something, scrape your foot or something like that. And because of that high level of inflammation, because of diabetes, you now find it is slower for you to heal. So in all, yes, we can deal with it. But the thing is, if you are a diabetic and you're already experiencing that pins and needles, or what people call junjuni, it means that your body is telling you that you already have poor circulation and you're now getting neuropathy or diabetic neuropathy.
And another thing as it relates to neuropathy, some persons, they may experience like itching on this, they get that itching sensation. Now the itching isn't external, but it's internal. And that's because of nerve damage. You feel that itching, but it's actually the nerve being damaged there. And the nerves are so sensitive. In 5 minutes, the nerves will be they started damage when the blood is deoxygenated, which is what diabetes do.
Does.
All right. So it's very imperative to hydrate yourself as well, to increase blood circulation, exercise, do your physical activities, get proper rest as well, because it also affects your blood circulation as well. And also try to eat a well-balanced diet on a day-to-day basis. Okay.
Definitely. One of the products that we carry at Batson Associates is balanced circulation. That we were getting some problems during COVID to get it, but we have corrected that situation. And that helps significantly, because what it does, it deals with the lining of the blood vessels, which is the endothelial lining. Also, I'm a huge advocate of nitric oxide. Because if you understand what NO actually does for the body, nitric oxide is a gas that is produced in the body. The raw material for nitric oxide is usually things like L-arginine, L-citrulline, which is basically amino acids.
That's right.
The thing with that is that what that product does is actually increases your nitric oxide levels. And we do carry a few others as well, depending on who we're dealing with, what we're dealing with. Even with men with diabetes, one of the problems that you have is issues with erectile dysfunction and that type of thing. And I mean, there's nothing to be ashamed about, in the sense that you are a diabetic, so you're in a position where you need help. So the thing is, you may not know exactly how to help yourself. And that's where people like myself come in, and Mr. Villalva. It's a matter of guiding you, because as he mentioned, when you have deoxygenation of your blood, so your blood does not have sufficient oxygen in it, it means that you're in a situation where even things like erectile dysfunction, your eyes, that's why diabetics have so many problems with their eyes, because you find that cerebral circulation, which is circulation in the cerebral hemisphere or the brain, is significantly compromised. I mean, when you look at the blood vessels in the human body, if you were to attach them to each other, they could actually make the Earth 66,000 miles, which is actually 2.5 times this Earth's circumference. So you have a lot of blood vessels in the human body, arteries, capillaries, veins. Once these become compromised, rather, especially microcirculation, which is circulation on the tip of your fingers, the tip of your toes, your eyes themselves. That's why diabetics usually end up with what is known as detached retina, or bleeding behind the eyes. Yeah. They usually have a lot of problem with inflammation in the back of the eyes, swelling in the back of the eyes, and all those things we deal with at Batson and Associates. But the thing is, a lot of persons do not understand the link, and most importantly, they don't know how to correct the situation. So you might be a diabetic, and you might be taking metformin, you might be taking glucophage, Janovia, Janumet, you might be using insulin and medication. Yeah. But the question is, where is the aspect of now bringing back balance to the body? Are you correcting your gastrointestinal system? Are you correcting your metabolic system? Are your hormones properly balanced? Most of the time, no. And that is one of the things that we actually work on at Batson and Associates. So again, those telephone numbers, quickly, you can get us at the first floor of Money Talks building in Montrose, Shogunas. That telephone number is 222-8261. That's 222-8261. Debe is the corner of Ramsey Trace and the SS Erin Main Road in Debe. That telephone number for Debe is 223-7515, 223-7515.
And our St. James branch is located on the Red Edge Mall in St. James, and the contact numbers are 220-8113. That's 220-8113. Our Tobago branch is located in Scarborough, Tobago, in the Triangle Building, and the contact number is 226-4553. That's 226-4553.
Excellent. Third base, sir, just give me a reminder in terms of our time. How are we looking there, sir?
Yeah, we have just about 2 more minutes. Sir.
About 2 more minutes. Okay, good. Right. So again, keep in mind we are live on our social media platforms. We are Batson and Associates Limited on Facebook. On Instagram, we are Batson and Associates TT. On YouTube, we are Batson and Associates Trinidad. And on TikTok, we are Batson and Associates Limited. So, with that information being shared, regardless of the issue that you're dealing with, whether it be diabetes, hypertension, we have been getting some really, really good results with high blood pressure, because I tell persons of the two things between diabetes and hypertension. Diabetes bad, but diabetes is kind of buy you some time. You see, high blood pressure, that's something that you don't play with. You can go to bed and your blood pressure becomes so elevated that you could actually end up with what is known as a TIA, which is a transient ischemic attack, or you could actually end up going blind. And I mean, I've known of instances, because the thing is, when you have elevated blood pressure, when you're asleep, sorry, you can have serious elevation of blood pressure during your sleep. And it could actually cause blinding. It could cause temporary blinding in most instances. There are some persons who have actually been blind for 1 week, 2 weeks. We have actually treated patients like that. So, that's just a warning sign. If you have a problem with hypertension and you're really serious in getting help, that is something that we could also address for you as well. So again, quickly, those telephone numbers and location: Chaguanas 222-8261, Dede 223-7515, 223-7515. St. James is Red Edge Mall, Western Main Road, St. James. We actually have open clinic day in St. James tomorrow, so that's Friday and Saturday. I will actually be assisting one of the consultants in that office tomorrow and Saturday. And those of you with online consultation, of course, you could also get information where that is concerned. As we always say at Batson and Associates, if you think health is expensive,
try sickness.
And if you think education is expensive,
try ignorance.
To the listeners of 106.5 FM, always a pleasure to be in your company. Third base, sir, till next week, God's willing. Do enjoy the rest of your evening.
It was a pleasure, and have a great
Thank you very much.
Yeah, boss.
Thank you very much, guys. All right, you've been listening to Batson and Associates Holistic Health right here on Freedom 106.5.
We are proud. We are affiliates. We are Trinidad and Tobago. 61 years of independence and 60 years as a republic. We
media.
celebrate.
We start our next program in a little bit. As actually
the ultimate one. CT 105 FM, Sangeet 106.1 FM, Freedom 106.5 FM, and the Sky 99.5 FM for independence to republic.
Yeah, guys.
So,
again,
achievements, our diversity, and
keep in mind that program that we have from 3 p.m.
journey of a
DJ Mapping on DJ Mapping.
activating social media stories,
Yeah, guys.
podcasts,
Enjoy the rest of the
on the air, online challenges, lots of trivia. Happy Independence, Trinidad and Tobago, from all of us at the TBC Network and Guardian Media.
Independence Republic is sponsored by Roof.
Yeah. Now we finish. I don't tell them.